Hi, this is State Delegate Mark Corman, and from Wisconsin Avenue in District 16 to Pratt Street in Baltimore to the Boardwalk on the Eastern Shore and everywhere in between, Conduit Street Podcast is the go-to source for news about Maryland politics and policy.
Hello and welcome to the Conduit Street Podcast. Kevin Kinnally here with Michael Sanderson. Michael, we were live in studio, quote unquote, last week. That was a nice change of pace, but today we are back via Skype over the internet. So it's a little bit sad not to be back in the office with you, but we'll do the best we can today.
Agreed. Enjoyed being on the actual Conduit Street, but always happy to join you for a recording and really excited about today's effort.
And today we are very excited to have with us Beth Blauer. She is the Executive Director at Johns Hopkins University Centers for Civic Impact. Under that umbrella is GovX, an initiative at Johns Hopkins designed to help governments use data to make informed decisions and improve people's quality of life. We'll dig more into that in a bit, Michael, but I know that you're excited for this one.
Just as an informal way, and we can let Beth speak to her path here, but I've known Beth from a while back when she ran the Maryland State Stat program, sort of a data-driven initiative for good and transparent government service. She came and spoke at one of the MACO conferences several years ago where we were talking about data-driven public policy and those sorts of things. I knew she had remained a big player in big data and government and so forth, but really, it's been Hopkins' role in tracking the coronavirus lately, not just for Maryland, but really on behalf of the whole world. That got us thinking she'd make a great guest for today, and we're really happy to have her plugged in and on the pod. So, Beth, thanks very much for joining us.
Oh, thanks so much for having me.
So, Beth, as Michael said, we're really happy to have you with us. We have a lot to get into, but can you give us a catch up on what you and your team do at GovX and do for Hopkins and for local governments across Maryland?
Sure. So about 5 years ago, after leaving public service and doing a short stint in the private sector, I joined Johns Hopkins University to launch GovX. And GovX was originally designed to work with Bloomberg Philanthropies as they were building out a strategy for mayors across the United States who were thinking about building data programs. And helping local governments understand what their biggest challenges were for setting up a comprehensive data and evidence-based programming and trying to close those gaps that exist at the local level. And we were a scrappy group that launched. And in our first 3 years, we went to more than 120 mid-sized cities across the United States where we helped to build up these data practices, governance and data inventorying, and some of the really sort of basic foundational practice that needs to be in place when you want to do any kind of data work. And since then, we have grown and we sort of identified early on that we had incredible subject matter expertise in government, some of the most important policy thinkers of our generation, but their data skills were not a match for their subject matter expertise. And so we launched an academy soon after we started doing technical assistance to help round out that skill that was really designed for career public sector servants that have raised their hand to say, I want to work in the public sector, and that wanted to sort of build these data skills that didn't necessarily come naturally with their subject matter expertise. And so the GovX Academy was launched, and it became our second center at the centers. And it was really meant to help, backfill some of that capacity that we were looking for when we were doing our work. And then we started to think about the role research plays in government and trying to create communities of practice that would bring researchers with government together. And so we launched the Center for Applied Public Research as a way to start to get really practical research out of higher ed to be easily deployed in government. And that's been a great success. We have a policy forum that exists within APP. And it's really designed to bridge what we saw were some pretty significant gaps around what was happening in the research world and what was really actually happening in the realities of government work.
Michael and I talk a lot about data and basically technology on this podcast and how it intersects with government. Talk a little bit about the role and why data is so important in good governance. And it sounds like your academy is really preaching the gospel there, but talk about the importance of data when it comes to government.
I've been known to say that I think data is already more important probably than cash for government at this point. It is the crude that is powering a lot of decision making and the positioning of government to continue to be able to meet the needs of all the people that live in our communities and that work in our communities and that are delivering critical services in our communities. It is also the place where we intersect most with private sector organizations, where we intersect with our residents, where we intersect with our other government partners. The transactions that have emerged in the last decade have been very much data-driven, much more so than cash-driven. It is one of the most essential and critical assets that we have. And the more subject matter expertise and comfort you have on your team for understanding how to value the asset and to make the asset work for you, we're seeing the more effective we are, not only at governance, but at building sustainable communities.
Right. I think that's so important. And we've seen counties across Maryland come up with these data dashboards, not just for COVID-19, which we'll talk about too, but the importance of data and GIS and how that intersects with county government is certainly crucial in all levels of government. But that's something that we talk about a lot. And I wanted to get your take on that. And I love the angle of it's actually more important than cash. I don't think a lot of people have thought about that, but particularly in today's environment, I think that rings true. And you can certainly see it with what we're seeing pop up across counties, cities, and state and federal governments as well in terms of data.
Can I ask a little bit of a naive question? I mean, everybody in Maryland is familiar with the sort of big presence in the state of Johns Hopkins as a giant institution. We know it's an institution of higher education and research, but also a hospital and a healthcare provider. So your center, by the way, I love that you described yourselves as a scrappy little group. No one thinks of Hopkins as as having little scrappy units, but I love that they have that enterprising mentality. But your scrappy group that has matured and grown, where do you fit in the larger complex of sort of higher education and public health and so forth within the Hopkins universe?
Yeah, so, a funny fact about me, I think when I was working for the state during the last economic downturn, I actually testified in a public hearing in Annapolis where I sort of swore never to work with higher ed because it was just one of the biggest challenges that I faced was getting data out of higher ed when we were trying to do reporting for the last Recovery Act. So I ate my words big time. And I landed at Hopkins, and I couldn't be more excited about it, honestly. Like, in retrospect, Hopkins has offered an incredible institutional positioning for our work, but also a credibility and a validation for what we do. We're in the Krieger School of Arts and Sciences, and I have a direct line to the dean of that school, where I essentially run our centers as a small department in the Krieger School. And we have student engagement in the undergraduate and the graduate population. But one of the things that I really appreciate about Ron Daniels' leadership is that he's really asked me to serve in a role to sort of break down the traditional barriers of the university. So I get to tap into experts from engineering, and I'm partnering, with Lauren Gardner now on the COVID work. And I get to partner with people like Josh Sharfstein in the School of Public Health as we think about what public health looks like in American communities. I get to work with, Hari Hahn, who is thinking about like the impact that democracy has on the evolution of community. So I'm part of the Krieger School, but I really am of the university in such a significant way because of the fact that I've been, really asked to push our way in and to leverage some of the incredible expertise that exists on campus.
Terrific. Thank you for that. It sounds like the best of both worlds, that your shop gets to be relatively nimble, but you get all those resources and, sort of like you said, the prestige and credibility that comes with an institution that's earned it over, centuries. So that's great.
And Beth, you mentioned COVID, and let's pivot to COVID. I think a lot of people around the world have seen that Johns Hopkins has been the leader in terms of data, back to data again, for the COVID-19 pandemic and how it's affecting countries around the world. Good data has proven to be very, very important in addressing this pandemic. What put GovX and Johns Hopkins into the spotlight here? Did you all just move quickly to launch an aggregator and it turned out to be the best thing going? Or how did this all come about where, you see Johns Hopkins everywhere around the world as sort of the official data provider when it comes to COVID-19?
Yeah, and I have to largely credit my partner in this work, who has been leading it, Lauren Gardner, Dr. Gardner, who works in the Whiting School of Engineering, because she had a very enterprising graduate student who was really concerned about his family back home where the disease was spreading. And they decided to track the disease like they had tracked many other diseases, like the measles outbreaks. And, this is what they do is they really think about the effects of disease on the built environment and in our communities. And they started with just a very basic aggregation of all the available data. I was actually about to embark on an international trip for the work I was doing at GovX. I was working with a team in Tel Aviv and with a team in India, and I was about to hit the road for some of those trips. And I was looking for information about COVID, where it was headed, what were being developed. And I realized that Hopkins had this resource, which was this international, very sort of beta aggregator of information that was giving us trusted information about where it was in those very early days. This was late February when I started looking and tracking the data to support travel decisions. And then I started to dig into the data more, and I realized not only is this really rich data, but we need to start thinking about what this infrastructure should look like when we actually start getting real caseloads here in the US. And so I reached out to Dr. Gardner through an initiative that had already sort of started at the president's office. And I said, we'd love to partner with you on this and just do a deeper dive on the US so that we can get a county by county perspective. Our counties are at the front lines of this healthcare crisis. Oftentimes they are the center for collecting a lot of this information. They're running our local health departments. And so I wanted to do a deep dive on what we could get and expose. And so that's when we started coming up with the data layers that are now in the US map that you can look at from the county perspective. And then we brought in a bunch of additional context because we know this isn't just a public health crisis. We know this is also an economic crisis. So now you can use the US dashboard as a way to track everything from the disease to what are the demographics of these communities, where we're getting hardest hit, and look at that case data in very near time.
That has proven, I think, to be really enriching part of this data collection and presentation is that it's not just columns of numbers or clickable maps, but to be able to go deep and see, like you said, the demographics. We know that there's been a sort of miniature policy debate in the state of Maryland and probably in lots of other places too about the state compiling and releasing demographic information about positive cases, about hospitalizations, and about fatalities. And there is pretty apparently a skew in that data that if you're not collecting it and sharing it and harvesting it, you might miss that there's something beneath the surface in the numbers. It's not just population and density. There's some demographic differences there that are meaningful in Maryland. I'm sure other places too.
Yeah, testing also, the testing data for me has been the most distressing because it's not only showing us that we're not doing enough testing, but that there are testing deserts all over the country and here in Maryland where people don't have access to testing that is free, that's not going to create further medical debt. And so what happens is people don't get tested. So we don't even know where we have potential outbreaks. And when we find out, it's ultimately too late because they end up, like you say, showing up in the hospitalization information. And so this local dive into the data has been fascinating because, there are a few major lessons learned. One is the systems just simply were not in place in many of the counties to do the kind of collection that's really required to manage a pandemic. So we see a lot of governments scrambling to make sure that they have the capacity, and in some cases they're doing it very manually to get the data. Another one is, didn't have these like data sharing agreements in place. So when the state has some data or the city has some data or the county has some data, there's no mechanism for sharing it. And so we're seeing a lot of local regions really scrambling to make sure that they have these agreements in place so that they can continue to get information that's really influencing policy decision making.
And Beth, when it comes to data, one thing I'm interested in is we know that people collect data differently. They base measurements on different things. How do you overcome that and make sure that everybody is on the same page and it's apples to apples when you're looking at data and making sure that it's all coming in, with the same sorts of measurements? People are collecting it the same way. How do you overcome that in such a short period of time to get all of this data online in near real time and really to be the staple of how the world is following COVID-19?
For me, it's like I'm in this very lucky position to be at Hopkins so that I've got these world-class epidemiologists, these medical professionals that are helping to scope all of the work that we're doing. And so it's not just that we're collecting the data and building out the algorithms for how we're going to pull it or building out the scripts for how we're going to analyze it and share it with the public. It's also being informed by some of the best science in the world. And I think first, that's a differentiator from a lot of the other efforts around sharing data and getting data out into the public. But ultimately, it's also critically important because it keeps our process, validatable, trusted. People are seeking it out because it's paired with that expertise. I couldn't do that. I'm a data nerd, right? Like I am not an epidemiologist. I don't know why, I didn't know that, like that the WHO recommendation for having testing positivity at 5% would be the right. We needed epidemiologists to come in and say that this is the WHO's guidance. This is why it's important. This is how we should level set all of our testing data. And then I get to build the back end of those platforms that allows us to share the data and do it in a way that's very democratized so that our public policy thinkers can integrate it into decision making. So very fortunate to be at Hopkins. I think all of this is happening in the absence of real guidance coming from the federal government, to be perfectly candid, where we really should be relying not just on these international health bodies, but also the CDC and the HHS, where we're not necessarily getting the most clear evidence. And a lot of that's being shifted onto local government. So in the absence of that, I think Hopkins has really stepped up as an enterprise that can help support a lot of this decision making.
So Beth, I have kind of a narrow question, and this may straddle the line between data nerd, which you self-proclaim as, but also the more complicated sort of deep health question. But I'll fire anyway. Early on in the United States, I think a lot of us who have been used to following this data sort of had a feeling that population density itself had to be a big factor. We were seeing lots of cases in New York City, a place we think of as being highly dense. And this seemed like it had a skew toward downtown areas. Now, I don't know if that's still the case in our perception or in the data, but the headlines now are Texas and Arizona, and they have downtown areas, but we think of them as being more spread out and sprawling areas and so forth, even if it's the big cities in Florida and Texas and so forth. Do you have any handle on how connected are the big numbers to population density, just as like a conduit for more spreading?
Well, I mean, we know that spreading happens when you're near other people, right? So like density is obviously going to be a driver. And particularly when we were just trying to wrap our heads around what this disease looked like, how it was transmitted. And we're still, to a certain extent, trying to really understand that. We know that population density is essentially a pre-existing condition to making spread easier. And that came out in the data pretty clear in New York, New Jersey, all up and down like the East Coast, where we have pretty significant density of populations. We don't have the sort of wide open spaces, but we also know that it is highly contagious. So it doesn't take much to transfer the disease from one person to another. And so I think the more interesting thing that we saw in the data, and we actually did a pretty compelling state by state visualization of this on the site, is that public policy was being developed with the best information, but not necessarily with the public, with the single track public health focus in mind. And so we see the sort of lockdown decision making and the early decision making around social distancing being effectuated, and we see the curve flattening, this language that we've heard over and over again. But as we started to see some of the countries around the world that had also flattened their curve start to loosen up some of those restrictions, we started to follow suit here in this country. And we saw a lot of policy making, particularly in the South, and particularly in places like Florida and Arizona and Texas, which didn't necessarily have a full handle on where the disease was, their testing, their contact tracing, where we saw that happening in other countries that were loosening up these restrictions. The sort of basic disease control best practices weren't in place, but there was still this tremendous pressure to open those economies because we also saw the effects it was having on people's ability to make a living. And so as they started to lift these restrictions, they didn't have the testing in place. They didn't have the contact tracing in place. They didn't have the sort of things that we knew that are going to keep the disease suppressed. And so now we're seeing the disease spreading because people are not necessarily wearing the PPE that is required to keep the disease from spreading. They're not at all in some cases abiding by the stay-at-home orders or the better-at-home orders. And so as you see more interaction, you're going to see this disease spread very quickly throughout communities. And a lot of that is just deeply connected to the fact that we just don't have the other public health systems in place to actually deal with the disease in the way that we're seeing it be contained in other places.
We saw literally just today, Governor Hogan in Maryland sent out a missive to his partners in local governments, including local health departments and liquor boards and law enforcement, saying, for us to continue with our reopening plan, we've got to be serious, particularly in bars and restaurants. We need to have people spaced out. You need to keep every other booth empty and all the limitations that are part of the statewide order. I think there's a vague sense that compliance is a problem, and sticking with it is part of us being able to pull off the next stages that we want. But I think that perspective all meshes together.
Yeah, and if you look at the data, as you see more and more of these reopenings, you start seeing the case data just drive up and up and up. And, there's a significant lag on the fatality data. That's the place where I stay up at night, right? Where I'm seeing all this case data go up and up. And we don't have the interventions right now that's going to actually suppress the worst outcomes. And we also know there's a tremendous disproportionality of Black and brown people that are going to die as opposed to white people. And I think, we have a moral imperative to make the right policy decisions for all people. And it's not necessarily manifesting right now in the places where we're seeing a broad opening and also where we're seeing a pretty significant rise in cases.
I think that's a great spot for a break. It's also important to mention that we're seeing, as these openings are happening, a lot more young people contracting the virus. But we're going to take a break there. When we come back, we're going to get into more about what Beth was just talking about, how the reopenings are affecting the country. We're seeing a huge rise in some states. We're seeing states backtrack in some cases. We'll talk about how the data plays into all that and more after the break.
Stuck inside and feeling helpless about the coronavirus? Wish you could do more to help? Well, here's a simple step that can make a difference for the next 10 years. Just fill out your census at 2020census.gov. The census determines how many vaccines we get, how many hospital beds, and how many school lunches. The more people complete their census, the more federal funding we get for all of those things. Please go to 2020census.gov right now and complete your census. That's 2020census.gov.
Welcome back to the Conduit Street Podcast. Kevin Kinnally back here with Michael Sanderson and Beth Blauer. On the front half, we talked about Johns Hopkins and GovX's role in tracking the coronavirus. We want to shift gears here a little bit and talk about the data more generally. Here in Maryland, it's become a daily routine for me, for all of us, to check the state's coronavirus page every morning. It's updated at 10 o'clock. And nowadays, we're watching the number of tests, the positivity rate, and of course, the total number of cases and serious cases across the state. And Beth, meanwhile, we're seeing, as we mentioned on the first half, the South and the Southwest go through a scary phase of expanded cases. And Michael, do you have any thoughts and perspectives here before we turn it over to Beth? Anything you're looking for in terms of what we can glean from the data from Hopkins and, what you can tell us about what's happening here?
Right now, I feel like an audience proxy that I'm eagerly anticipating Beth helping me be a better consumer of the data that everybody's presenting to me. So trying to make sense of this stuff, and we all are. If she can help steer us, I'm excited to hear it. But yeah, I'm looking at Arizona with a lot of fear.
Yeah, so Beth, when it comes to Texas, Arizona, Florida, what should we be watching? Let's say for Houston and also for Baltimore, how can we make sure that Maryland, Baltimore does not slip back into where Texas, Arizona, and Florida are right now? What are the key metrics that we need to be watching?
We definitely need to be watching the case data. I think for us, I'm intently looking at the testing data. We want to see the number of tests increase steadily. We want everyone to have access to testing. We don't want to have any barriers to testing. But not only that, I think that we need to look at the percent positivity. If we see that tests are increasing, but positivity is increasing, that's still an indicator that we're not doing enough testing. We want to be able to really understand the community impact that the disease is having. And if we're above that 5% threshold, it's not just that the disease is intensifying, it's also that we are losing ground on our ability to test everyone who needs it. And so I think that we should take a keen eye to looking at that. A couple of other areas that I think that we should be thinking a lot about is a focus on contact tracing. Contact tracing, as we know, is once you get tested, if you come up positive, then you've got the ability to let everyone know you've been in contact with in the last 14-day period that you've come up positive so that they can quarantine and stay out of the community to help control community spread. So a couple of things in there that are really data driven. The first one is, how long does it take for test results to actually come back? Because if you get a test and then you don't get your results for a week to 10 days and you go about your business, especially if you're asymptomatic, then you run the risk of exposing everyone that you come into contact with the disease. And so we're looking at that measure of how quickly we can get the result turnaround, and then how quickly can we get the cases traced once we know that there's a positive. And so there's a lot in there that we need local leaders to be leading, which is we need communications around answer your phone when the health department calls so that you can be so that contact tracing can be effective. We need pressure on the labs to make sure that we're getting the information turned around quick enough. And we need to make sure that we have local resources so that everyone in our community has access to testing if they suspect that they're sick or if they're interested in knowing their status.
I think it's interesting you talked about positivity rate and testing. And if the positivity rate's not below 5, then we're not doing enough testing. I noticed, and I think this is still true, that Florida is showing about 11% in terms of positivity rate, but it seems like they're doing a lot of testing. In your mind, does that mean that the disease is intensifying or potentially mutating in some way? Or do they really need to ramp up their testing? I know they were a little slow out of the gate, but still, that seems like a really, really high positivity rate. What are your thoughts as we just talk about Florida?
Yeah, that's essentially double what we're looking at for the standard. And so I think that, Florida was very hesitant to engage in the policymaking required to do the initial lockdown. And then they were one of the first states to reopen up. We've got Disney opening up this week. Did Disney actually open up this week? I think that was the plan, at least.
Yeah,
they did.
Yeah, these are just decisions that are being made on the economics, which are also a critically important component of this. We've been spun into several different crises, and one is certainly an economic crisis that needs to be part of the calculation. But with data that's coming out of the state that's showing a disease that is very active with a population in a state that has an aging population, even though we're seeing more cases in the younger population, it's very risky to continue and not to sort of revise. And we've seen some of the revision to the stay-at-home ordering and also compelling folks to wear masks. But a lot of this is really not necessarily a health infrastructure issue. There are major components of it that are, but it's also a policy issue. And this is about leadership. And this is also about, are we looking at a comprehensive view of data to inform these decisions so that we can control the disease and also protect gains that we've made in the economy in the last few weeks?
So Beth, one of the things you mentioned was the turnaround for test results, which I have to say I haven't really been attuned to as a piece of data to be watching. Is that something that our public health authorities are collecting and reporting? I mean, is this something that there's a place I can look and find in Maryland or in my county? I live in Anne Arundel County, that I can find out, what would be the turnaround if I go get a test at CVS or at, one of the multiple facilities in and around my neighborhood?
I definitely would, before you go and get your test, ask how long the turnaround time is. The data is not widely available. We're trying to put pressure on the labs, on those that have the data to start to really be able to take a look at it, because I think this one is going to be one that's going to influence a lot of the disease spread right now and in the coming weeks and months. And so there are some places that will say that they're rapid, which means they have already procured the rapid test where you can get that information within an hour or two. I know that there's some sites in Baltimore that are already using those. Anne Arundel County has actually a pretty great communications platform. So they're calling individual residents, explaining where they can access services. There's pretty good information about the labs where testing is available and information about specific case data that's emerging from the county. It's happening in an ad hoc way across our counties with very little standards around what data should be released. I think the state did a great job at compelling the demographic breakdown of information. They led by example in a pretty great way, and they actually were able to lead a lot of our other states into sharing the data at the zip code level. But I think that these other sort of cascading measures are going to emerge as being more and more important. And I think we should be putting pressure on our local governments to be pretty clear, and also to help them to negotiate for faster turnarounds on a lot of this information so that they can get a better handle on where they have positives.
And Beth, before we shift gears a little bit here, as we're talking about positivity rates and the number of cases, what you've seen in Maryland over the past week or so, we've talked a lot about the southern states and the issues that we're seeing there. California has backtracked on their reopening plan. Give us a sense of how you think Maryland is doing. I know today we had an uptick in new cases, but what do you think so far? I think Maryland, we've seen a great downward trend over the past month or so, but it seems like there's been a slight uptick over the past week. How do we make sure that we don't slide back and that we're not California and that we have to sort of shut things down again? And what are your thoughts on where we are right now?
Yeah, I mean, I think that like a lot of, it's so hard in the summer. We want to be at the beach. We want to be on the boardwalk. Who doesn't love a great Ocean City summer? Who doesn't love to be out? This is the time of year where our state really shines, whether you're, in Deep Creek Lake or whether you're at the shore. And I think that it's very hard, but we have to remember, even if we're going to take advantage of some of the sort of natural beauty that our state has, we should be abiding by those same social distancing policies. And what we're seeing now is people feeling a little bit more relaxed because we have a little bit of confidence that we were past our big spike. And what we're seeing in the South, and the lesson to be learned here, is that we're not immune for an even bigger bump. And so, I think it's a bit of that sort of, we need to make the right policy decisions so that we can control the social distancing, the fidelity that we have to mask wearing, the fidelity that we have for having parties and having large groups of people congregating. But, spending more time outside, it does reduce risk. But if you're right on top of each other, it's still going to be a risk. So there's lots of different things that we can do to keep ourselves safe. And I think that we're going to be looking, look, we had the highest number of cases confirmed yesterday since very beginning of June, when we were at the height of the disease here in the state of Maryland. It's definitely concerning. Monday's data are typically a little bit inflated because of the weekend effect, but when Tuesday's data comes in, we're going to have to really look at whether or not this is a trend or whether this was just a reflection of a smaller bump that was happening over the weekend. And we got to keep a close eye on the data and make sure that we're holding ourselves accountable to the things that we know will work in containment.
part of that, I assume, has to be being aware of small sample size issues. Like one day's data is not enough for us to necessarily set our hair on fire and run around. But, if we see this as a multiple day trend, that, wow, this whole week looks like day by day higher than where we were as a 7-day running average a week ago or a month ago, that becomes something we can sort of hang our hat on more. I think, we're all trying to make the best use of the information we've got. That's got to be part of it, right? I mean, as a data person, there's sort of asterisks that go with all of this, I imagine.
Yes, definitely. And I think that's for me, I look at Mondays as an outlier for the week. It's always going to have a bump from the weekend. I want to see what the next several days of data brings, but I'm also observing my own observations. I'm being, I'm a single mom, I'm a widow, so I'm the only parent in my house. I've got young kids. And for me, I'm making these observations. I'm going to the grocery store in a full-on respirator. I'm being incredibly careful. I'm doing very little interacting. And when I'm out and about, I see that a lot of, Marylanders, are not necessarily yielding all of the sort of recommendations for those best practices. I'm not saying they all have to be as protective as I am, but I'm saying you should wear a mask anytime that you're out in public. You should be observing hand washing and hand disinfecting practices. We need to, and I think that the people of New York can tell a tale very different than the experience that we had. And we just need to really sort of stay true to what we know works. I know it's not ideal. We don't want to be at the beach in a mask. We don't want to be at a restaurant in a mask, but it's a short-term pain for what could be a very long-term gain. That's the lives of, hundreds and thousands of our neighbors, our families, and our friends.
I don't have any problem at all signing up for that bottom line, driven by data and by common sense and the best science we've got, that there are a lot of best practices that we as citizens can engage in to protect our neighbors, to protect our community, and our economy. All of this is bundled together. So to some degree, I guess this is, there's some controversy about what the government can ask and expect of its residents, but there's an awful lot of common courtesy involved here. So I'm down.
Thank you. And I know my kids thank you, because they're just as panicked as I am.
We have a similar circumstance in our household, so I feel some kinship. So if we can shift gears a little bit for a pet side conversation that I want to have, and I feel like you'd be in for it. We're right now, I think, collectively all talking about, well, are there any silver linings that are going to come from having endured this pandemic? And we know that there's a great deal of hardship and loss, certainly public health and with loss of life and with economic loss and so forth. Aren't there some upsides that happen that we're going to take better practices or do some things better going forward, or we'll learn from this? I feel like, maybe in addition to getting rid of some terrible buffet restaurants, which is probably a good thing.
Yeah, exactly.
Right. And handshaking, I think we kind of endorse that's probably over. So I wonder if the glamorous high data dashboard might actually really have its day. I think there's always been an audience for that kind of thing, but it's just certain type of people. And maybe it's Conduit Street Podcast listeners who represent very much that, the Venn diagram is kind of a big circle. They're the same people who love a good dashboard. But I gotta say, I have grown in my appreciation for a well-constructed, particularly a website that shows me information in context with percentages, with rates of change compared to something else that's relevant. Give me some colors or make the most important things largest font and that sort of stuff. I love it. And I feel like this is the time for dashboards to take their rightful place as a centerpiece of transparency and communicating to the public. Am I on the right track there as a self-confessed data nerd?
I hope so, for sure. Look, I've been screaming from this rooftop for a decade plus, and no one ever invited me on CNN until now. So that's So yes, I think for sure. I think data is having just like this most magnificent moment right now, where for the first time, public data is not only driving the public policy decision making and the public health decision making, but people like my dad are looking at the dashboard to figure out if this is the day he goes out and does his grocery shopping, or if he should just stay home and sort of hunker down and keep my mom safe, right? Like people are using this data on a daily basis, just like they're looking at the weather or the allergy report or whatever it is to figure. I mean, the Weather Channel literally put the coronavirus data on the app because they realize that people want to know if they're in an upward tick, they're going to change their behavior. And I think one of the failures that we've had as a data movement, particularly in government up until now, was that we haven't been consistently pairing the fact that we're collecting and sharing data with these calls to action, right? We're not just sharing the coronavirus data. We're also saying like, stay home, stay safe, wear a face mask. These are call to actions that are going to make your neighbors healthier, that are going to keep you safe from a disease. Like these are things that are deeply personal. But we also know that we have the same level of data on some of the other kind of pandemics like hunger and crime that are riddling a lot of our communities. And we haven't been effective at using them and putting them in platforms that allow us to normalize the fact that these are really hard things that we're trying to track in our communities, and we need the public help to help solve these problems. I started this work when I was in the state of Maryland, and we tried to do things like Baystat, where we gave you like critical suggestions on how you can use data in your personal life to improve the water quality of the Chesapeake Bay. But I really think that as we think about dashboarding having this moment, it must be paired with the very concrete terms that we need to engage the public in order for us to move our communities forward.
I've got an appreciation for that. And I feel like even just in my lifetime, the presence of more sophisticated information has worked its way into the public consciousness. I mean, even just things like the wind chill. We report the temperature, and over time, for a while, I remember in my childhood, the weather report would say things, but it's going to feel like it's only 15 degrees because the wind is going to make that 28 degrees feel cooler. We call that the wind chill effect. Well, no one needs to have that spoon fed to them anymore. You know, like you mentioned the allergy report, like pollen counts and so forth for people who are sensitive to air contaminants or pollution indices and so forth. Those sorts of things have become relatively familiar and comfortable to hear and process. The anecdote about your dad, like if this kind of data on the public health issue of the moment can become a what's in it for me moment as a listener or reader or as a website visitor, that's a way to bridge the gap between we've got this arsenal of information that you can't access to actually here's something you need and you want for right now.
Yeah, I mean, nothing tears me up more than getting that dumb bill from BG&E that shows how bad I'm doing compared to my neighbors on energy conservation. Right. But that's like a full-on data report that I get, you know, that really is it, and it does inform my behavior. I'm like, oh, guys, we're going to pump the AC up to 75 during the day, so, you know, dress down.
Yep.
These are the things that are already happening, and I think people also expect government to evolve in the same way. They want government to really like be more predictive about what their needs are and be more effectively trying to evolve the way that Amazon can tell you what shoes you actually really want or what clothes, you know. There is so much deep learning that happens in the back ends of systems that we're already interacting with on a daily basis, and government hasn't caught up to it. And so just by like having superficial dashboarding doesn't necessarily scratch that itch either. We really need to start skilling the public sector in a way that can effectively use data to optimize services so that you're not applying for free and reduced lunch and then you have to essentially provide the exact same information for utilities arrearages and for food assistance and for, you know, we need to start being smarter about how we create a safety net, how we actually engage people in the conversation at the government level. And if we continue to not evolve these skills in the public sector, we're going to continue to have distrust. we're not going to have the right voices at the table. And there's going to be another, we're going to continue to have these struggles where we're completely out of touch with the realities of living in our communities.
I think that's a great point. And I mean, I love sports, I love data, and I have long been a fan of predictive analytics and linear regression and trying to figure out how data affects sports and athletes and trying to make predictions. And it's true. I mean, that data is useful everywhere. You talked about some areas of government where we could really use this aggregation and making sure that everybody understands what's happening. We're making the best decisions. One interesting piece that I've found people often complain about in government is, hey, we have all these big tech giants. They're luring away all of the talent. These people that are graduating from schools and they're super smart and they have all these skills. How can government better attract these candidates? How can they recruit these folks to bring in to sort of set the table and do exactly what you're talking about? That's a challenge, I think, that we face at every level of government. Do you have any ideas on how we can improve that sort of retention, recruitment, and getting these folks in the door to make these changes that are so important?
I've had this ongoing theory that I've kind of been nourishing throughout my 10, 15, almost 20-year career working in the public sector, which doesn't seem real to me. And it really is rooted in one thing that I think we take for granted. When I first started this work, I was drawn into the public sector because I wanted to make a difference in this world. My first job in government was as a juvenile probation officer, which was essentially like a social worker in the juvenile agency, where I was working with families in a really crisis moment in their lives. And I made these observations about the fact that there was no interoperability between social services and the schools and all the other agencies of the state and local government. That was creating a disservice. And that's kind of what lit my passion, for moving into the data and interoperability space in government transformation. But here we are now, that was almost 20 years ago. And we're dealing with the same problems. I mean, we could have the same kind of conversation with a juvenile probation officer today that I experienced back in 2002, and nothing would have changed. So, or many things wouldn't have changed. So my bet, and we also at the same time went through this sort of real, put a lot of eggs in the basket that millennials were going to flock to government and be transformative. They were going to build apps. They were going to do all this really cool stuff. They were going to bring all these 21st century skills that didn't exist. And that really hasn't materialized because we never created the conditions for them to be successful in the workforce. I think the other big piece of this is that we have people who are so committed in mid-level and frontline and leadership levels in government to working and staying in government, who have incredible subject matter expertise, that are experts in their field. Some of the best scientists, some of the best logistics people, some of the best planning people, but they went to school and they were trained at a time that didn't value a lot of the sort of digital and data skills that we know we need now in government. And so my bet is we should go in and do some significant skilling in our workforce in a way that will actually produce the return that we have been waiting for, right? If we just go in, and that's a lot of the work that we do in the academy here, is trying to sink our teeth into those people that have already made a commitment to be career public sector employees and to really bring their skills up to the level where they can usher in this new era of using data, aligning data to outcomes, and being really transparent about how we do that in the public.
I think that's a great point. I think that's great advice. And, again, that's a question that often comes up. And I hope that people hear what you said and, conform to it and try to get that training in place and make sure that they're reaching out and finding that talent that maybe just needs a little bit of updating in terms of, how to use the latest software and how to read the analytics and interpret them and put them on a website and a dashboard, like Michael was saying, because I agree with you. I think the talent is there. It's just a matter of transferring that talent into, the digital age and making sure that we're able to present this information in the way that people want to see it presented. Like you said, Amazon, you can see exactly on the map where your package is. We've seen counties be innovative. They have pothole trackers and things like that where people can see it in real time. But I hope, and I know that Michael hopes and our listeners hope, that we see this catch on and that we use this at every level of government so that we are as transparent as we can be and that people have the information that they need to make critical decisions in real time. So I think that's great advice, and I'm really happy for your perspective there.
And maybe one of the paths forward here is for governments and the pure public sector to maybe emulate the model that Hopkins has used for your unit. I mean, you're within the College of Arts and Sciences on the academic side, but you get to draw on these other resources, and you end up being sort of a nimble, interdisciplinary unit that draws on every other component that the Hopkins institutions can bring to bear. Maybe Baltimore City or Montgomery County or Charles County can do the same thing and say, rather than having a deputy director of IT be the one person who does all this stuff herself, we create some sort of gig-based unit or some interdisciplinary outfit that brings things together and interacts with public works and takes what they can get from them and works with public safety and so on and so forth. But maybe we need to think differently about the way we arrange and organize and present and articulate all these sorts of things in the public sector. We're not known for innovation, but maybe we could be. That could be the next thing.
Yeah, let's do it. I mean, I think I think also Mako is in a great position to start really having this conversation materialize and bring in best practices. We've got models. Bloomberg has an innovation team model that's really been well received in cities. And maybe there's some way that we can work together to help bring some of these best practices to light for our Maryland counties.
I love it. I love it.
Fantastic. Absolutely. So, Beth, I mean, we've covered a lot of ground here. Is there anything else you can think of that might be useful to our audience for county officials or others who are just interested in state and local public policy?
Yeah, so, while, a lot of the work I do is focused on cities, we actually have some really great work going on with counties, and we have some terrific free resources on our website at civicimpact.jhu.edu. So if you've got any questions or if you want to look more into our work, I invite everyone to take a look at our website. And obviously, around the coronavirus work, we have some terrific resources as well that are free, like our contact tracing training program here at Hopkins. And so I'm a resource. I'm a Marylander, very proudly. And so anything that I can do to help, I'd be really happy to help.
And Beth, how can people follow you on social media, or Hopkins, or any of the, GovX, anything that you represent? How can they follow along on social media?
So at Civic Impact for our Twitter handle, I'm also at BI Blauer, BIBLAUER on Twitter. And then, I'm Beth Blauer on LinkedIn. Feel free to connect, and I look forward to working with everyone.
Thanks so much for joining us, Beth. This was everything I had hoped it would be. I knew you'd be a great guest, but also delighted that you're a proud Marylander and we were able to have you join us today. It's great.
Oh, thanks so much for having me. Next year in Ocean City. Woo-hoo.
All right, that'll do it for today. If you enjoyed the podcast, please go ahead and subscribe. That way, all of these episodes will be sent directly to the device of your choice. You can also follow along on social media, Facebook, Twitter, and of course, the Conduit Street blog. We'll also link all of Beth's social media accounts and the website in the episode notes of this episode. But for now, for Michael and Beth, this is Kevin signing off, and we will talk to you soon.